All right, so the cost of caring, that was the question that we started this whole session with, wasn't it? And I always say that the cost is either charity or tax. What do I mean? Now, the purpose of charity is that you give, not to receive, but there's something intrinsically that it does to you. It enhances you in some way.
Yeah, nothing's better than giving to those that cannot necessarily give back to you.
Exactly.
Beautiful feeling.
And that feeling is intrinsic, it's internal.
Okay.
So we know that there's a cost of caring, and that cost is either vicarious trauma, burnout, compassion fatigue, and all these things that are associated with caring, especially those people who care from the heart. But when you when you're prepared to give more than what your organization is paying you for, your employer, right, then it becomes something that is intrinsic. Do you understand? Almost like a spiritual journey that I'm giving you even though you can't give me back, and my satisfaction is not dependent on anybody else.
Okay. And
that I find helps with this feedback loop, this discrepancy feedback loop, because your aim, a part of your aim, yes, we work for money, we've got to maintain ourselves and our families, but there's a percentage of it now that becomes something that you're seeking for yourself, your own agenda. It could be a spiritual one, a religious one. It may be that someone thinks, well, listen, I'm going to give this charity because I believe that one day I'm going to get it back.
Yeah.
By your creator, for example.
Yeah.
Do you understand? And many people have different beliefs as to what charity does for them.
Yeah.
Or the second cost is tax. And that tax is that rather than you giving based on your own volition, the industry, the field will take from you. And when it takes from you, that's where we become fatigued, compassion fatigue. That's where we have burnout. That's where we get anxious. This is where we get panic. This is where we have an array of conditions that affect us psychologically and affect the way how we turn up to work, and affects our temperament. It affects our character, our personality, and then or sometimes people bring everything to work. They wear the facade, but then when they go home, their families and their relationships are suffering because they've got nothing more to give.
Yeah.
That's what I refer to as being taxed. So we've got to take.
How do you manage
Yeah.
not being taxed?
Yes, well, by being willing to give from my heart, charity. Do you understand? I always say, I came in, when I first came into nursing, and I seen the disproportionate amount of black males that were being sectioned under the Mental Health Act. And, the people being restrained and given medication, and I wanted to stop. My vision was, listen man, I gotta stop this. I've been hearing about this, it's well documented.
Yeah.
My thing is, I want to contribute to stopping this, but I realized the problem was way bigger than me. So what could I do?
Yeah.
Without my discrepancy feedback loop, my Judge Judy telling me, Levi, get out of here. There's no point. You're not going to make any difference, so you might as well knock it on the head.
Yeah.
But how I appeased that discrepancy feedback loop was by little things, by creating little things into my work life and work habit that allowed for me to feel good, like smiling. I said to myself that NHS is not paying me to smile and have a good conduct with my patients. Treating them with dignity and respect, irrespective of how they're presenting.
Yeah.
I'm going to speak to you in a way that promotes your dignity and your respect. I'm going to validate your concerns as best as I can, whatever it is.
Amazing.
Do you understand?
Yeah,
so that helps me. So every time I can get that every day. If I'm feeling a bit dejected, like bloody policies, bureaucracy, all the crap that comes with professional working with people as a professional, I can easily just go out, have a conversation with an individual,
Mm-hmm.
and I can get that feeling. Just talk to me.
Yeah.
How is it being in hospital? Even if you're telling me I hate this place and blah blah. Yo, listen, I feel where you're coming from. Do you understand?
Yeah.
And automatically, just the fact that, you know what, they felt listened to.
Yeah.
Oh, I've done my job. You've helped me.
And that's one of the key things for especially those who are bogged down.
Yeah.
The voiceless.
Yes. Yeah.
To have a voice,
Yeah.
for someone to talk to them and to listen to them.
Yeah.
They now feel like they've got a voice.
Exactly.
And having a voice is empowering.
Yeah.
You know what I mean? So
super empowering.
Yeah.
So but we have to create within ourselves the capacity to care. Do you understand? And that's the area that I've been looking at most within the last 18 months to 2 years, is what is the internal environment that we create within ourselves that allow us to turn up to work and care. As our friend, a friend of mine, he coined it mental wealth. He says mental wealth. He says we need mental wealth, but when you really look at it, when you have wealth, the more wealth you have, the more you can afford to give in charity.
Yeah.
So if we accumulate mental wealth, the more we can give from that to people.
Yeah.
But what are some of the concepts that help us look towards our own health, promoting our own mental health, our own psychological safety? You know, you mentioned earlier on about you're losing two of the young people that you work with.
And you know, for me, 6 weeks holidays, I've hardly worked.
Yeah.
I said,
Yes.
I need time out.
Exactly. Yeah.
And being able to say no in my field.
Yeah.
You know, because there's always somebody that wants something.
Exactly.
And you got to be able to say no.
Yes. Yeah.
And having someone to talk to.
Yeah.
Like I would assume that there's a lot of clinical supervision that takes place within the NHS.
Well, should.
Oh,
should
Oh.
take place. Any nurse watching should take place.
But there isn't that governance again.
Yeah.
And it's down to, especially for like community-based organizations, it's down to them to implement that clinical supervision,
Have to.
get counselling. And for me, for a long time, I wasn't operating with any of that.
Yeah.
I wasn't operating with any of that, but now
listen, man.
it's a must. It's key. And that vicarious trauma that you spoke about, you know, I've seen a lot from being, you know, involved in crime in my youth. And I've seen a lot of things. You know, that us as a generation, we lived very fast and had witnessed and experienced things that people twice our age hadn't experienced. So I think we definitely took on a lot there. But coming into as a professional, I feel I have seen more.
But and this is the thing. But what are some of the things that prevent people from seeking help, seeking things like clinical supervision, therapy? Because there's barriers for professionals to access those things. And what I've seen, and from my own experience as well personally, is that how easy is it to admit that I'm not coping very well? Because
you could lose funding in certain cases. You could lose funding. And so some people would put the mask on, as you said, or they have to.
Exactly.
Because that is what's going to enable their funding to continue.
So they plow on, don't they?
So they plow on.
If you're a practitioner, you're a professional. Maybe you've just qualified, or maybe you're a senior professional, and you're not coping because there's things that's going on in life, in your personal life. How easy for you to say, look, listen, I'm not coping as a junior member of staff, because now you think that this is going to impact upon your competency. Do you understand?
Yeah.
So it creates, to a certain degree, a cognitive dissonance whereby whenever there's a cognitive dissonance, you cannot face the reality because either your thoughts or your behavior has to change.
Yeah.
All right. So, like you said, saying no. If I've not faced the reality that I'm not coping with my current workload or this current situation that I'm in, it means that I have to say no. But if you haven't faced that reality, you're going to continue to say yes.
Yeah.
And if you continue to say yes, the problem's going to snowball. It's going to become out of control. Anxiety is fueled by a fear of losing control. That often feeds anxiety. Now you're going to get more anxious because you're getting overwhelmed.
Yeah.
You get overwhelmed, you're going to get burnt out. But what is burnout? What is burnout? We hear this term, right? Get me excited, man, because this is serious.
Talk to me. What is burnout? Because I feel like that's for you mental fatigue as well as physical fatigue.
Exactly.
And a sense of hopelessness.
So it's sort of similar to like depressive symptoms.
Wow.
But in the medical field, we have what we call the ICD-10. Right? Soon it's going to be the ICD-11, which is like a catalogue listing the symptoms of all illnesses. So, for example, if I was depressed, or I'll go to the ICD-11 and it would list what are some of the symptoms, common symptoms, classical symptoms of depression. Now, burnout has been entered into this catalogue, the ICD-11, as a syndrome.
I'm like,
yeah.
Wow. Wow.
Yeah, as a syndrome. Now, there's a three-dimensional model to this burnout, yeah?
Mm-hmm.
The first one being a sense of exhaustion, like fatigued, within the context of the workplace, like, Monday, you already get that feeling on Monday morning.
Yeah, because I see some people when they post on social media, and they're upset it's Monday morning.
Yeah, Monday is like the worst thing ever. But when somebody's burnt out, that feeling is amplified, multiplied by 100.
Right. Can't
get out of bed. Maybe they start to become absent. Their sickness levels goes up. Now, obviously, that causes its own capability and performance issues, which is going to be managed accordingly, depending on the policy of the organisation. But secondly, you have an increased level of negativism and cynicism. But what does that mean for an organisation where people are negative, extremely negative? So you as an employer, you want to implement something that you feel will make a difference based on your vision, based on your positive energy.
Yeah.
But then you got burnt out staff who are just like, just enough.
And this is ringing bells with some of the partners that we work with.
Well, exactly. Now, thirdly, which is the most worrying for me, is this sense of inefficacy, feeling like I'm not making much of a difference anyway. So what's the point? Now, we're not going to get rich, let's face it, from working with people.
No.
Unless you're a big time scammer. Yeah? But working with people, you're not going to be, rich. You're going to live a comfortable life, But essentially, we're trying to get something intrinsically. And this is what all these types of work, initially, when we go back in the days, working with people, good people used to work with people.
Yeah.
Do you understand? Because good people cared for other people.
Yeah.
But that's where the cost comes in, the cost of caring, because somebody who's naturally an empath or somebody who's naturally compassionate, right, they're going to perhaps struggle with saying no, which is no, because their predisposition and their nature is that they like to help people.
Yeah.
So saying no to somebody in need actually becomes a big problem, which can't be overlooked. It shouldn't be seen as weakness. In fact, that's just a symptom of their caring nature. Unfortunately, people who care for people and they enter into these jobs with their heart, unfortunately, the literature suggests that they are people more likely to be burnt out and have compassion fatigue.
Yeah.
Because you don't just turn up to work. The only reason why you was affected by those youth that were murdered was because you invested in them.
Yeah.
You became attached professionally. There's some emotional attachment, and it's impossible. I don't care what anybody says that. If you're working with people, it's impossible not to have some emotional attachment. This is why what I preach is that it's important for us to be in tune with ourselves and to create an environment internally that is conducive to providing good care. Do you understand? We have to look at our habits. We have to look at our journey of personal development and how we're engaging in that journey. What does it look like? We've got to map it out.
Yeah.
In order to sustain upon this path of looking after other people.
Wow. That's deep.